As the coronavirus outbreak continues, what steps can be taken to prevent the virus from spreading, and how can you protect yourself?
Dallas Ontiveros joins us live from Adventist Health Castle in Kailua with more. Dallas?
Good morning, Christine and Kelly. That's right. With this ongoing outbreak of the coronavirus, we're learning more details on how to prevent the spread and just general knowledge that you should know about. And here joining us on Take Two, we have Dr. Takkin Lo. Good morning, Dr. Takkin Lo. How are you?
Good morning, Dallas.
Thank you so much for having us today. Now, this is kind of my first question right here. When I meet someone new or introduce someone, what's the proper way to greet someone?
Well, normally, for many years, we've been touching each other, doing a handshake.
Yeah.
Which nowadays we should not.
So what do we do instead?
Well, let's try that,
Okay. The elbows? So
yeah.
This is safe. This is a safe tactic.
This is definitely safe.
Okay.
The other way is just to say hi and smile and bow.
A good wave or bow. Awesome. Now, Dr. Takkin Lo, what do you specialize here at Adventist Health Castle?
Well, I work as a pulmonologist here, so I'm a lung specialist.
Okay, so you've been very busy. I mean, you're very busy throughout the entire year, but with this ongoing outbreak of the coronavirus, you've been answering a lot of questions and concerns.
You are absolutely correct. I think all the pulmonologists around the islands here and around the country actually are dealing with this, and the respiratory problem is what the coronavirus is. So we are like in the thick of things.
And speaking of respiratory problems, a lot of people have been wearing face masks. I live in Waikiki, and that's pretty much all I've been seeing. And at the airports and stores, are those even effective at all when it comes to the coronavirus or other illnesses?
Well, coronavirus is a very tiny little minuscule virus. For you to wear just a regular mask, it does not matter. It does not do anything for you in the first place. Now, if you're sick, putting the mask on is actually helpful because it helps prevent you from spreading the secretion around to other people. So if you're wearing it for the purpose of preventing other people from catching it, then that's actually a good thing.
So only wear a mask if you are sick?
Only if you're sick. Okay. And if you are dealing with, like if you're a medical professional like ourselves here, we will wear them because we have to deal with a lot of people that are sick and for a long period of time. And if you're not dealing with a lot of people that are dealing with a lot of time, you don't have to.
And when you're dealing with a lot of people, you're obviously touching a lot of things, doorknobs, elevator buttons, whatever you could really think of. And all our germs really just live in our hands right here. So hand washing is very important.
That's right. And we're going to show you actually how we're going to do proper hand washing.
Okay, cool. Let's go ahead and see it. We have our demonstrator, Lonnie, here. What's up, Lonnie? How's it going?
Good. How are you?
Good, good. So what's the first thing that you want to do?
So you notice that the first thing she did was actually touch the faucet, and she's actually touching the cold water faucet. The study really have not really shown to make the difference whether you're using the hot or the cold water. And to save energy, we really don't really recommend that you use hot water. You can just use the cold water. The first thing she did was wet. W-E-T, wet. We wet the hands, and then she noticed that she turned off the water. So we don't waste any other water. Then she pick up the soap. She get the soap for really nice volume in her hands, and then she's gonna start scrubbing it. So she wet, and then she lather, and then she is scrubbing without the water running, and she is singing happy birthday twice to herself. Or it takes about 20 seconds or so. Now, if you don't like happy birthday, if you don't want to sing it twice, some other nursery rhyme or whatever that is more than 20 seconds would be a good thing. You notice that when she was washing it, she's getting it she need to get the crevice where all the bacteria are, actually right in the nails. Then she pick up and rinse out the water very nicely because, if you have any soap left on your hand, you're going to cause a lot of irritation, and we don't want that soapy material on your hand. Then she turn off the water. Notice that she turned off the water before she dries because you really not going to be passing any bacteria by touching the faucet after that as well. When she dries it very dry because if you have any residual wetness in the hand, that moisture is actually where the germ is going to stay, and you're going to pass it on to the next person as well. Okay. So then she dries it up, and there is your hand washing.
Let's see them, Lonnie. They look very nice, very clean. Now, something I just noticed in her hand washing skills that she took a moment to really get underneath the fingernails. Germs live under your fingernails. I don't think a lot of people recognize that.
People don't know that actually in your hands, the most the most important spot to wash is around your nails, because that's where the maximum amount of germs are actually residing. That's where they hide, because there's no place else in your hands to hide. So make sure you go between your nails, go to the back of your hand, as well as including your wrist. So not just the palm.
Okay. And then what about jewelry? Should you remove jewelry before washing your hands, or is it okay to have them on?
I think it would be okay to actually have the jewelry on as long as you're really rubbing it around the area, so that you can kind of make sure that you get to it.
Okay. And then, I guess really quickly, how often should you clean your jewelry if you wear a lot of jewelry on your hands?
That's actually, official guidelines for jewelry is not there for the medical field, but you can see that if you go to a jewelry store, they recommend that you kind of go and clean your jewelry every 3 to 6 months.
Okay. All right. Good information right there. Thank you so much, Dr. Takkin Lo. He's still going to be hanging out with us for Take 2 when it comes to the coronavirus and other general illnesses. But until then, reporting from Adventist Health Castle, Dallas Navarro, sending it back to you ladies in the studio.
Some very, very good tips.
Yes,
I think when people, you can tell people wash your hands and wash it for a certain length, but when you actually see, you have to wash it this vigorously in this certain way. It's like, it's a whole new story, you know?
Definitely true, especially for the 20 seconds, he was saying that to sing the song in your head. You think you wash your hands for long enough, but when I was watching that, it's like, oh, maybe it's not usually that long that I do. All right, need to work on that.
Yep, good tips. As the coronavirus outbreak continues, what steps can be taken to prevent the virus from spreading, and how can you protect yourself?
Dallas Ontiveros joins us live from Adventist Health Castle in Kailua with the details. Morning, Dallas.
Good morning, Christine and Kelly. I am still hanging out here at Adventist Health Castle with Dr. Takkin Lo. How's it going, Dr. Takkin Lo?
Dallas, you learned as well. This is
yeah.
how the new handshake is.
I've been paying attention to all your tips when it comes to avoiding the spread of the coronavirus and other general illnesses that you should know about. In the last half hour, we were talking about the proper way and how to wash your hands. And there's a lot of different steps when it comes to hand washing. But for people who just missed out on that moment, how important is it just to keep your hands washed, and how many times should you wash your hands in a day?
Well, we should be washing your hands as often as possible if you are especially having any kind of dirty material in your hand.
Okay.
You should wash your hand whenever you touch anything, even your pets and so forth, any kind of working environment, sports environment, if you play sports, and definitely wash your hand before you eat and so forth. But the CDC actually has official recommendation in terms of the 5 steps to hand washing. And as you can see, the line of wire here is actually showing us a demonstration on how to do the washing. First step is actually, first you wet your hand, followed by lathering the hand, then scrub it, and then rinse it, and then dry it.
Great reminders right there. And you mentioned the word environment, whether it be a work environment, a school environment. When I think about environment, I think about all the places that are in a room and all the different surfaces that could be carrying potential germs. How often should you check your surroundings and make sure that your surfaces are clean so you're able to not spread any viruses or germs in your home?
Well, in the home, I would just check it every day. I would just kind of make sure that there's nothing that is actually out of the ordinary, especially in this environment where we actually are really very, very heightened awareness in terms of the coronavirus. At our clinic and so forth, we're actually cleaning it almost every hour. We're that serious about cleaning. We clean out every time the patient comes through the room. We wipe them down every time. And what you're seeing right now, we actually have a demonstration of how to actually clean the surface. And you notice that first of all, she can clean it very nicely in a circular motion. So she's to kind of go through that and making sure she's not missing any of the corners. There's many times those corners are the one that actually where you have the highest bacteria or germs that are staying in there. Dirt also is an environment where the bacteria and germ can actually stays in. So you got to make sure that she's doing that. And she noticed that she's actually wiping them through and not going right back to the same spot. Otherwise, you'll be spreading the germ into the same spot. We also would like to have material that you're using that actually going to have a dry time that is very, very short. Okay. We want to have a dry time of 2 minutes. Sometimes some of these material that you're using may last 3 to 5 minutes. We don't want that.
So stay away from the old sponges, the old t-shirt rags, like those type of cleaning products.
You're right. On the other hand, make sure you don't wipe off after you have cleaned up. Make sure that it dries up, because the drying, that 2-minute drying is actually what kills the germs. Okay. So if you wipe it down with the wet material and then instead of waiting for the 2 minutes to dry and you wipe it up with another dry cloth, that totally defeats the whole entire purpose. So make sure you have a short dry time, but you do want to have that dry time of 2 minutes. Let it dry for 2 minutes, and then that your place will be good to go for another day.
Okay, I'm seeing a theme here with the 2 minutes because that's also the recommended time that you should take to wash your hands.
That's right.
Okay,
yeah. For
perfect.
20 seconds for you washing your hands.
And the whole entire time,
process,
20
yeah,
minutes.
right.
Okay. Now, something I've noticed Olivia is using is some cleaning products. And, you know, something about the coronavirus is that there's a lot of information out there, you know, a lot. And it could be confusing some people. And some cleaning products in the back near the labeling says that, it's used for the coronavirus. So people are thinking like, oh, if I get this cleaning product from the department store, I'm safe from the coronavirus. But that's not exactly the case, right?
Not really so. Yeah, so I would read the label. We want something that actually going to kill. So what she is using is ammonium chloride, and you can see that actually will kill a lot of the germs. Their percentage, we want to have any kind of alcohol material that is actually 60 to 65% more for surfaces that you can handle alcohol. You have to kind of look at the material, look at the label of those bottles. I don't condone one particular product versus another, but you have to make sure that the material is safe for the surfaces you're wiping.
Okay. And then just really quickly, I want to squeeze this question in because I think it's pretty important. There might be some people who are watching who may have the symptoms of a fever, whether it be shortness of breath, chills, or, sneezing or coughing. But what's the biggest factor that separates the common flu from the coronavirus?
I think one of the things that you have to remember is this coronavirus, the three major symptoms is first of all the fever. As you can see that everybody at the airport is checking the fever. So if you have a high fever, 100.4 or above, you have the shortness of breath or coughing. So you have those three major symptoms. That's alert you to thinking that you might have it, but unfortunately, the regular flu, the cold, all these other viruses, infection that you have, respiratory infection, have a very, very similar kind of symptomatology as well.
Okay. So, and what about traveling? So if you travel to China or any place that has been infected by the coronavirus, that definitely makes you more of a case compared to someone who has never traveled and who's feeling a little bit sick.
Very, very important. Travel history now is very important question we ask. That is actually the number one first question we ask every time we are actually seeing a patient. Before the patient get to see me, when they do the intake in the outside, when the nurse is checking the patient in, first question we ask is, have you traveled?
Okay. And then I just want to wrap this up right here. I know we're running out of time right here, but our area is just... It's a very mixed community with a lot of tourism, people from around the world. How do we not feel so paranoid with that in mind?
Dallas, the most important thing is use common sense. Be helpful, be preventative, and actually make sure that if you're sick, stay away so that the rest of us don't catch it from you.
There you go. Thank you so much, Dr. Takkin Lo, for that conversation. Of course, we'll have all these tips and information on our website today at KHON2.com. And until then, reporting from Adventist Health Castle, Dallas Navarro's working for Hawaii.